Services Committee to order. Welcome, everybody, and anybody who may be watching. So the first item of business this morning is to approve the minutes of the January 19th meeting.
I will make that motion.
Commissioner Nissen moves to approve the minutes. Do I hear a second?
Second.
Commissioner Gardner seconds. Any discussion? Hearing none, indicate your approval by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries. We have no agreements, contracts to do today, so we'll go straight to general business discussion updates. Michelle, we're going to talk about a child support update. Welcome.
Good morning.
Good
Good
morning.
morning.
I am Michelle Shute, the Child Support Supervisor. Thank you for inviting me here today. It's a pleasure to meet you, Commissioners Anderson and Gardner, and actually it's really nice to see everybody. This feels like kind of normal. To be in a room with people, it's kind of nice.
Nope.
I thought for the sake of the new commissioners that I'd take a few minutes and just talk and give a little overview of our department, what we do, and our role in health and human services, which might be a refresher and things that a lot of you in the room have heard before. Oh, sorry. Our goal or mission is supporting children, healthy family relationships, engagement of fathers from birth, economic stability, healthcare coverage, and family violence collaboration. We locate parents, establish paternity, establish court orders, and collect support. Our services are available to parents of minor children if one parent is out of the home, parents who pay child support through court-ordered income withholding, those who have court-ordered custody of a minor child, and those who receive public assistance. A case is opened when either parent applies for our services or when a referral is made through the Financial Assistance Office. Referrals through the Financial Assistance Office allow both parents' income to be considered when a child is receiving public assistance. This is done as an assignment of support to the state of Minnesota, which reimburses the public assistance programs. These programs include cash assistance, medical assistance, child care assistance, and foster care programs. We also assist our social service department with genetic testing as needed for child protection cases. Please don't hesitate to stop me if I'm talking about something that you want to know more about. I'd be more than happy to explain it, or at least try.
Excuse me.
Yes.
Feel free, if you're comfortable, feel free to take your mask off.
Okay, are you having a hard time understanding me as well?
It's up to you, but you're
Okay,
welcome.
I just want to make sure everybody here is comfortable, so.
Yep, no.
Okay, all right. Let's see here. Our program helps establish a financial partnership between parents. Our services address financial, medical, and child care support. These three elements are combined to come up with a monthly support obligation. We are a team of 10, myself, 6 child support officers. Currently we have 1 position open, 2 support enforcement aides, and 1 office support specialist. If times were different, they would be here today so that they could introduce themselves and tell you themselves a little bit about their work. So hopefully next year we can do that. We are basically 2 teams within 1. The establishment team consists of 2 child support officers. They establish paternity, including genetic testing, and establish court orders. The enforcement team enforces the court order, which includes numerous enforcement remedies such as occupational and driver's license suspension, recreational license suspension, tax intercepts, financial institution levies, contempt of court actions, and many other things. They also modify existing orders, and there are 4 child support officers that make up this team. Our support enforcement aides also carry caseloads, which consists of our interstate cases, and these are the cases that we have that we're collaborating with other states and other countries. Our locate cases where they're using numerous tools and methods to locate parents, and our income withholding cases. These are the cases that we refer to as our working cases. We are collecting money, but we need to make sure that the case continues to be successful, and we monitor the case that way. Our office support specialist, we have 1, handles all the details to get the cases where they need to go. She makes sure documentation is what it is and what it is supposed to be and where it needs to be. Schedules appointments, handles phone calls, and many, many other things. I cannot possibly do justice to the details of the work that they do. But anyone in our department would be more than happy to meet with any of you at any time if you're interested to know a little bit more about what they do, maybe spend some time with them in the office and have an in-depth conversation with them about their roles in child support. I also invite you to contact me at any time with any questions you may have about what we do, how we do, and why we do it. The next thing I'm going to talk to you about is our performance. How is our performance measured, and where do we receive our funding? As with many departments within Health and Human Services, there are performance measures and incentives tied to those measures. The Federal Office of Child Support provides incentives to the states based on performance. Each state receives a piece of the pie, for lack of a better example. There is just one amount that is going to be distributed to all the states. This incentive is based on state performance, so the better you do, the bigger piece of the pie that you get. Minnesota provides incentives to the counties based on that same formula. Support performance is based on the federal fiscal year, October through September, so we have received our performance report for 2020. Performance is based on 5 measures: paternity establishment, support establishment, collections on current support, and collections on past due support. Also, cost effectiveness, the amount that we collect for each dollar that is spent on our program. For fiscal year 2020, Candioi County maximized our incentives, which means we received the highest amount possible in paternity and support establishment. We received 94% in current collections, 98% in arrears collections, and 90% in cost effectiveness. I want to add that with the cost effectiveness measure that it is received in 10% increments. So you go from 20% down to 90%, there's nothing in between. So I'm really quite happy with how we're doing. The percentages for current collections and arrears collections are always the hardest to get, and this is as high as we've been for a while, so I'm pretty pleased with that. This performance is important in terms of revenue, but it's also a good measure of customer service provided to the citizens of Candioi County and the work that we're doing in the office. Historically, Minnesota has been a high performer, receiving a nice share of the federal incentive dollars. However, other states have improved their performance, which means less dollars for Minnesota, even though our performance has not declined. I believe the barriers to improve performance are technology and support. Our computer system is outdated, and DHS has not been able to provide the needed support and direction to the county workers.
I have a question on your paternity establishment number on the handout we got.
Mm-hmm.
109%. How do you get over 100%?
That's based on a 2-year average.
Okay.
They go back 2 years because they look at the cases that paternity wasn't established in the preceding year, and then they average it over 2 years, which is why that gets to be that way. Yeah, it doesn't seem really possible, but they compare those two because that's kind of where you start and where it ends. So
Thank you.
does that make sense? Kind of.
That takes care of that question.
Okay, all right. Some case composition trends that we're experiencing. In 2020, it's no surprise that we saw an increase in cases referred from the Financial Assistance Office. We saw a 34% increase in cases referred due to the receipt of medical assistance, and a 30% increase due to the receipt of cash assistance. This resulted in a decrease of 20% in our non-public assistance cases, which is an unfortunate trend, as the last few years we had been seeing the pendulum swing in the other direction. So hopefully, once we're past this pandemic, we can start to go the other way again. In fiscal year 2020, we managed 2,077 cases, which is actually 5,154 clients, as each case has 2 parties. We collected $5,824,098. As I mentioned, there's been a change in trends. I believe this is largely due to the COVID-19 pandemic. The peacetime emergency has prevents us from proceeding with contempt of court actions and some of our enforcement remedies. We are grateful for that decision, which allows us to make appropriate decisions in the best interest of our clients. You can't collect money that isn't there to collect. But at the same time, there are children in need of support. So it's a difficult balance, the non-custodial parent's ability to pay and the financial needs of the children. The child support officers have done a great job in getting orders set and modified to appropriate amounts, and we've been able to maintain our performance goals during this complicated time. We have an open child support position at this time, which will not be filled until In-person training resumes at the Department of Human Services, and our staff can interact safely. We rely heavily on team learning, which is not yet possible. This delay will help our performance in terms of cost effectiveness, but not sustainable for long-term planning and succession, as it takes about 2 years for a child support officer to have the knowledge and skills to perform the work. We have a strong collaboration with the county attorney's office, court administration, and local attorneys. This has been very helpful in our response to the pandemic, and we're grateful for that. My staff has an extremely complex job to do, and they do it well. We have 204 years of combined experience, which is irreplaceable. They understand the importance of enforcing financial responsibility, but to do so with respect and professionalism. They provide an incredible service to Candy, Ojai County. My goal is that you find our work of value and interest, but not of concern. If you have any questions at all, I'd be happy to try and address those for you.
Thank you, Michelle. I think you said it, but I forgot it. How many staff members are there?
10,
10 of you, okay,
with one open.
and one open, all right. Thank you. Any questions for Ms. Shute?
Yeah, just a comment, how the program has grown over the years and how effective you are. I give you a lot of kudos for that. It's not always an easy job. The people you're working with aren't always happy. I know that by past experience. So thank you for what you're doing. This is outstanding. Really good to be able to recover those dollars to help the children and the families, as well as save taxpayers' dollars, for sure. So thank you.
Thank you.
Good department.
Mm-hmm. Every dollar collected is a dollar saved, I assume.
Yes,
for
absolutely.
the taxpayer.
Absolutely.
Commissioner Anderson.
Yeah, I just have a question now that it says $5.8 million was collected. Is that from from child support, or is there money from the state that comes to this?
No, that's the child support dollar.
That's just strictly that?
Yep.
Okay. And then how much, what percent do you think the county has to kick in on this, or is it all just?
You mean in terms of the cost for the program? You mean?
Yeah.
Well, reimbursement for the cost of our program is at 65% from the federal government.
Okay.
So, 35%, how much of that is actual county dollars and state dollars? I don't know that number.
Okay.
But that's the reimbursement for the costs of staff and other expenses.
All right.
So,
Okay.
pretty good reimbursement, really.
All right. Yeah.
Any other questions or comments? If not, thank you very much for coming in and
Thank you.
sharing the information. And
Yes. Thank you for having me.
yep, have a great day.
Nice to meet you and see you all again.
All right, next on the agenda is the Advocacy and Inclusion Matter of West Central Minnesota, AIM, and Valoris Anderson, the Executive Director, will be sharing information with us. Welcome.
Welcome, or thank you. It's one of those mornings. So, I guess I gotta put the password in.
Okay. Let's do this. Shoot. Okay.
Sorry. A little excited. It was having technical difficulties earlier.
Well, we have it too, just so you know.
Great. Okay. Well, all right. I'm Valoris Anderson, and I'm the Executive Director for Advocacy and Inclusion Matters of West Central Minnesota, which also is referred to a lot by AIM. That's our abbreviation. So I started in November of 2020. Before this position, I worked for CandyWorks DAC as their administration's manager and rec and leisure coordinator. I'm also a co-guardian with my mother, Maydeen, for her brother, Michael, that lives in a group home here in Wilmer. And then my children and I have also been volunteers for AIM for about 4 years, which we very much have enjoyed. it's fun to see a little bit. My kids are 12, 9, and 5 currently, so it's very fun to see them interact with different people and not think anything of it. So it's very encouraging from a parent standpoint. Our mission at AIM is to advocating for full inclusion of people with intellectual and developmental disabilities so they may lead healthy and independent lives, which I am so thankful for being located in Candido County. We, the people here are very welcoming to anybody with disabilities or other restrictions and stuff like that. So we, as AIM, provide educational experiences and social events and volunteer opportunities to enrich their lives. We are also very thankful for other programs like WCI, WAVES, local businesses that provide, and our providers that enrich them in other lives. Our history of AIM, which I've been researching, something that I enjoy doing is kind of knowing where places that I've worked, what their background is and how they established. So in 1957, ARC of Candido County had its first meeting, which was held at the Lewis family cabin, which I haven't found out more to see who that actually is. But it's been kind of interesting. I've been calling some past people. It was led and driven by parents with children with disabilities. Also formed a board that is made up of parents, professionals, and providers, and school staff, which is currently how we're operated. We run roughly between 5 to 13. We don't have the bylaws that it has to be one way or the other, so we can just run that depending on how they feel things are going. Past executive directors, Mary Reuter, Gina Rex, Kelly Doss, but due to, and this has happened, they had talked about it multiple times when I was looking at history. In February of 2016, ARC of Candido High Board of Directors decided to reorganize and change the organization's name to Advocacy and Inclusion Matters of West Central Minnesota, AIM. Was an interesting thing. I kind of, like I said, I was researching this. I seen it a couple times. They discussed it a couple times of switching due to all the extra fees and stuff that they had with ARC, and they weren't having the freedom to maybe run the programs and different things that they wanted to do as a group. So that's why finally they decided to change in 2016. People first is probably one of the bigger things that everybody is used to hearing of what AIM is. So it's a self-advocacy group led by them. Represented, they have their president, vice president, secretary, treasurer, member of large meet. They meet on they'll meet today. They'll meet today to discuss what they would have typically on the third Thursday of the month. Usually they try to plan the calendar for the whole year. Due to COVID, we are unable to have any of our events, but they are still meeting as a board or officers club, so they know what's going on, and so they feel connected. Different things that they get to do, they make sure that they have Adopt a Highway. They would try to do the nursing homes, go to the Humane Society, coach for special ed, food shelf drives. They do a lot of things. They also help with different, projects that they come up with, their themes that they do on their nights on that Thursday. They're the main ones to make sure that that event on Thursday gets a speaker to talk about education, advocacy, plus their rec and leisure if they want to have bingo or a meal. They're the ones that coordinate that. We have a People First advisor that helps making sure that things are run properly, that they are within their reason, making sure that, and then I, myself, help in the aspect of making sure they have a location to have their meeting. If they need somebody to come and speak, I will help them coordinate that if somebody is having issues doing it on their part. So AIM as a whole offers quite a bit, more of the bigger scenes and small. So we offer classes for members or their parents and guardians. Sometimes they're held different ways, just depends on what we're offering. We offer a training in self-advocacy, guardianship training, transition, internet training. Our consumer conference usually happens in August. We're looking at or April, looking at changing it to August. Consumer conference is where they have a one-day event, and some years we have where they can take 4 classes, sometimes they can take 2 classes, depending on, we just try to switch it up so that it's not the same every year, and they can learn about different education, safety in measures, making sure they're checking what's needing to be done for themselves. Healthy living class is a huge class that loves to learn about their health, continuing to make sure that they're healthy in their aspect and in their mind. And we partner with Caris Health on this. The town hall forum includes representatives from the city, the county, the state, to make sure that the People First representatives can talk to them, tell them what's going on, the challenges, the needs, the frustrations, the joys of being in this county, too. Our spring dance, which is something that's a real joy for them, which they unfortunately missed out on in 2020, we hope it gets to be, is partnered with the Wilmer National Honor Society and held at the Wilmer High School. So Wilmer High School has their prom on Friday night. On Saturday, they get to have their spring dance. So we very much appreciate all of our partners in our different aspects. We partner with a lot of different organizations throughout the year. They're currently the officers for People First have to decide tonight which Stingers night they are going to. We are ready to do that. So usually yearly AIM hits somewhere between 1,000 different people in one way or another. And so we are in West Central Minnesota, primarily in Candido County. But if somebody from another county hears about us and wants to be, we greatly encourage them to attend any of our events if they can get to it. That we hold almost all of our events in Wilmer. Due to we have a higher population in Candido County, Wilmer area, and we have a very great facilities that equipped for them, you know, with the disabilities that they have. So we very much appreciate that. What we are trying to do is making sure that we connect people with other people in different organizations, their interests, their desires. Maybe they just want to learn, you know, maybe sometime they might want to learn more about the county commissioners. I know they have, Raleigh's been at one of the Corky has been at the town hall. So they very much appreciate getting that opportunity and talking. We provide opportunities through classes, events. We also help with scholarships. Our members live on a low income. So we try to help them go to camp, classes, events. Our events, we try to keep them very low. So roughly maybe 10 to 20 bucks for all of our events that they do. Class sizes just depends on what event's happening. Our dances can be up as 200 to 300. not including their staff that they also have to bring in. And classes, depending on which ones they are, 10 to 20. We are very grateful for volunteers. We, as an organization, run a very small budget and heavily operate on our volunteers, which I think is great for them to have connections on who they are, who other people are, what other people do, and how they can strive to be better themselves and work towards different things. So we're grateful for that. Our funding is individual or organizations. So people will give memorials in honor of somebody, and different smaller organizations also help with some of our events. So they'll sponsor certain things. They like and enjoy doing that. Grants are, a lot of our grants are program driven. So our healthy living, usually we try to get a grant, and that is designated only for that class. And then we get a couple other ones just for general operating. And then our main one, some of you might know, our rose sale. It's our bigger fundraiser. If you haven't gotten a rose before, they're very beautiful. Fudge sale and our prom dress sale. Unfortunately, last year we were starting that prom dress sale, and we weren't able to have due to the COVID.
Did the rose thing happen this year?
I have a meeting tomorrow, and I am very bound and determined to make sure that we get them roses
Okay, I get-
delivered. Last
I've been
year,
active a couple of years distributing them, so.
great. I will make
forget to-
sure I get a hold of you.
All right.
Unfortunately, last year we purchased, or everybody was able to buy, but we weren't able to distribute just because we couldn't. At that time, it was so new. It just happened in April, and so with the pandemic, nobody was thinking fast enough on our feet to make sure that the roses got to everybody. But I'm working hard to make sure that happens because it's a very good thing to do. So if anybody has any questions on anything, I'd be glad to.
A little story. Trade Home Shoes is where I worked for 30 years, and our store was downtown initially.
Okay.
And above our store, and where Elmquist is now, there was the Elks Club.
Yes.
So they had I think it was their fall dance there, and they really pounded the floors. It reminded me, the Geico commercial where they got the stomp. We could tell they were up there. I'll put it that way.
Yeah, for sure. They love to dance, and it's been fun. Like I said, I worked for Candy Works CSC. We also had one of the experience. I had one of the experience. We had a Christmas dance. Mm-hmm. I couldn't sit down. They kept come more. So yeah, it's very enjoyable. It makes your heart feel very warm and everything. And with that, I just appreciate the time that you've taken. I also would like, I know with Candy Works not being around anymore, it's harder on everybody. It's actually touched me in a couple spots, unfortunately. Mm-hmm. But when you are looking at, when that time comes, if you're able to distribute any of those funds, we as AIM would be greatly appreciated for anything. We always are appreciative for people wanting to reach out in any way to help us. And like I said, our volunteers are our heart, and I feel that gives so much and helps us keep a smaller budget and everything.
Are there any other questions or comments?
Well, actually, the question I had, and you kind of answered it, what can we do as a board to be more supportive of the programs that we have here? And I'm really glad that you hit upon how we're a regional center. People actually move here for these kind of services that we have. And I think that's something to be really proud of. It's not only good for the community that people come here and they're employed here and all this, but it's a good message we're giving out there. And I think you answered that question, and I hope that as a board we can see that those dollars stay focused in that area. But that's something that probably will come up later. So
yeah, in another point, granted, in a personal aspect I get to work with, but I feel very grateful to the social workers that we have here in Candy Ohio County. They are very knowledgeable. They know what they're doing. They help. They try to help in any way and touch base. I've actually loved working with the one for my uncle. I love talking to anybody that has any different aspects and roles in it. It's just great how everybody in this community is so welcoming. And so we just are so thankful that we're able to be in this community as AIM. So thank you so much for that.
Thank you.
Yep.
And anybody else have anything they want to add or ask? If not, then Valeris, thank you very much for coming
Thank
in and sharing with us. Appreciate it. Last thing on our agenda today is COVID-19 status update. Ms. Libbert?
Yes, good
all
morning.
yours.
Morning, yes. So as you can about imagine, it's been a busy couple weeks again for us in public health. We've continued to work very closely with Caris Health as we manage to get the vaccine out to our community. As of last week, we did finish our 1A priority group. So this means that everybody in that 1A priority group would have had the ability to get the vaccine. They might not have chosen to, but would have been offered the vaccine. This was done in a combination of ways. So we at local public health held a number of drive-through clinics. Again, we held those at the Rescue Squad building and then also had a couple at the old recycling building. Caris Health did a multitude of shots on our behalf. They reached out to different groups and businesses in the 1A category and opened up time slots at their Lakeland clinic downstairs is where they're holding vaccine clinics. And then again, our pharmacies, Walgreens and CVS, they completed vaccines for the skilled nursing facilities and the assisted livings in town. Just to give you a summary as to where we are at with vaccines in our county, as of yesterday, we have had 4,369 individuals that have received their first dose of the COVID-19 vaccine. That's about 10% of our population. People that have completed the entire series, again, it's a 2-dose series, that we have had 789 individuals that have received their second dose. So that's 1.8% of our total population. That's really in line of where we're seeing things at the state level. So at the state, individuals with 1 dose, that they're at about 7.6% of our entire state's population. And then people who have completed the entire series, that's at 2% of the entire population. So most recently now the state is surveying local public, anybody else in the 1A category. So they're making sure that there's nobody that has been missed that would want the vaccine in that 1A category. And then they reach out weekly with a spreadsheet to us at local public health with anybody in our county that has not been vaccinated or been given a chance to have the vaccine. So we'll make sure that we keep up with anybody that would have been missed. We are now working locally on the 1B category. The state has announced a big push for those over the age of 65, K through 12 educators, and then child care providers. Those are who they've announced fall into the 1B category right now. There's also some other businesses and groups that fall into 1B, but right now this is the highest push from the state level. It's really been hard to plan for these vaccine rollouts because, again, we're still getting some individuals from the 1A now who maybe had chosen not to get the vaccine when we first offered it, and now they maybe are feeling more comfortable and feeling like they want to get vaccinated, so trying to allocate those into some of the doses we're getting. Along with this, state has incorporated some additional folks into the 1A category. So I think last week they included medical transport drivers and bus drivers now, so we'll go through those groups and get them vaccinated. The healthcare systems, they seem to be getting more access to vaccine than we are at local public health. So as of last week, our allocation for this week, we're getting about 200 doses. The healthcare systems seem to be getting, roughly 600 doses this week. So with that, we're really fortunate to have the great partnership that we do with Caris Health so we can get the vaccine into the arms of people. Ultimately, we don't care if it's local public health or the healthcare systems giving the vaccine, just as long as it gets out to our community members. We do have adequate staff and volunteers, so we are prepared again at local public health. If and when we get a mass influx of vaccine, we can do hundreds of doses a day, and we've got plans and we're prepared for that. We're using a system called PrepMod, which is an online database, so that really streamlines our efforts when we have these vaccination clinics. I think from the time somebody enters in to get a shot and the completion of doing all the screening and paperwork and asking questions and giving the individual's education, it's roughly about 4 minutes, so it goes pretty quick. Caris Health is reaching out to those individuals over 65. They're using their MyChart, and also I recently heard they're going to be sending out mailings. They're really focusing on individuals 85 and older right now. So I encourage anyone who is a part of the Caris system to make sure you get your MyChart set up, but also just be on the lookout for a mailing for when they have time slots opened. They are opening up time slots throughout their entire CentraCare system. So if you're not able to get into a Wilmer site, you certainly could see if you could get in at their St. Cloud or Redwood site somewhere close by. They are also assisting us with the 1B category with the schools right now, so they're reaching out to the school nurses and making sure that school educators are getting in to get vaccinated. The state most recently announced some pilot sites. These include Andover, St. Cloud, Fergus Falls, Rochester, Mountain Iron, Thief River Falls, North Mankato, and Marshall. Along with, just on yesterday, they announced 2 permanent community sites, one of those being in Minneapolis and the other being in Duluth. And then they're going to be doing a multitude of vaccine distribution at the Xcel Energy Center. There has been a lot of confusion, and I think I've touched on this in past presentations that I've given just on the vaccine rollout. There's been a lot of confusion and frustration from community members on the differences just between other counties and cities and how the vaccine rollout has taken place. Each county and area of the state is at a different phase and has a different process for completing their priority groups based on a couple of the following, which I'll mention. It's all dependent on how much vaccine they have been receiving, how many people and businesses fall under each priority group, the number of other providers in their community who are also receiving vaccine. So this, again, depending on if they have multiple healthcare systems in their community, if they have additional pharmacies, and then us at local public health. And then if they really are adhering to the state and MDH guidelines and following what their recommendations are to us at the local level of who falls into which priority group and making sure that they're distributing that way. So our county, as I've spoken to in previous presentations, had a large number of people and businesses that fell into that 1A category. That's why it took us a little bit longer to be able to complete this list and now be looking at those K through 12 educators, childcare providers, and especially those over the age of 65. We have tried and will continue to keep our messaging strong and be very transparent as to where we're at in the county with vaccine distribution. We'll try to keep that timely. I'll try to continue to send out press releases and be on the radio, and I know Caris Health has been on the radio a number of times too. I think now our next steps will be working on some additional educational tools and flyers and handouts, because I think now as we continue with vaccine rollout to more general populations, some people might be fearful of getting the vaccine and hearing some myths, and we want to get the facts out there to people. Our staff have still been fielding a lot of calls from the public. Again, I want to make it public right now that there is no waiting list. We will contact you. Your health system will contact you to receive your vaccine. Our staff are really doing tremendous work. They've been so flexible and creative throughout this whole entire process. One other change just at the state level, and for those watching, MDH has recently launched a COVID-19 vaccination map to help people find vaccine providers close to them. The other thing that MDH has put into place is they have a 72-hour distribution policy now that all vaccine providers must adhere to. So what that means is anybody that's receiving COVID-19 vaccine, they have to get it out into people within 72 hours upon arrival that the vaccine comes. So for us, that means that we don't have a lot of time to plan and get messaging out for when we have clinics. So again, if you fall into the 1B category, I encourage you to be watching local media, newspaper, radio, look at our Facebook site. And again, we've been sending out messaging to people's employers if they fall into the different groups, and same with Caris Health. So I want to reassure everyone that we really appreciate people being so energized about the COVID vaccine being available, but also to be patient with us. We're doing the best that we can, and our community partners are as well. I can speak to Caris Health on that. They're doing a great job at getting the vaccine out, but it takes time. We're limited with the number of doses that we're receiving. So other than that, I would be happy to take any questions if anybody has any specific questions.
So any questions from the board?
Corky had one, right?
Or-
I'll have one, but
Go ahead, you can go first.
Commissioner Berg, I saw your hand first, so you get to go first.
Well, first I want a couple comments I want to make, and you kind of answered one of them, but as a board, I think it's really important that we provide you with the resources you need. And it sounds like you're not asking for any further resources, but if you see there's a need, be it staff, be it dollars, this is such a major thing for our community, for the world, actually. And I want to commend what your staff is having to deal with. You normally have your normal job, and I know well that we don't have extra people just sitting around. So you're busy anyway, and then we got this COVID on top of it, which is changing every hour, and it's been doing that for a year. And I really appreciate your comment about being flexible. And I think that's what we have to be, is really flexible and move with that. And as a board, we want to support you and thank you and all the staff what they're doing. We're going through this. And I think it's really excellent that all the media information you're trying to get out there. And we're barely into 1 month of the vaccines, and it's going to come, and let's keep hoping. It's not going well. I'm not saying it's not going well here, but when I read in the media, it's not just our state, it's all the other states are wanting more vaccine, and you're all geared up and you're ready to go for that. And I appreciate that, and you're moving forward. I did have a question about the funding. You're not saying you need the resources in that. And this is probably for Mr. Kleindall too. Is there any county costs when we're looking at budgets that can be laid back on us? Because my understanding, most of the funding is going to be reimbursable through the state and the federal government.
Yep. So we did recently, I think it was yesterday, the state came out with an additional allocation for CHB. So between myself and Jill Bruns, the public health director in Renville County, we'll look at that split. I don't even remember off the top of my head. I just glanced at it yesterday. So I can bring that back for my next presentation and let you know what that allocation was. It still wasn't enough to cover our staff time. That's really where we're dedicating a number of our resources is with our staff time. But our staff are tracking the amount of time that they're putting into the COVID response. So we still are hopeful that at the state or federal level, we'll see some additional funding come down to local public health.
Okay, thank you.
Thank you.
have-
Commissioner Anderson.
Yeah, I got a couple calls about, from corrections officers, and I know I emailed you about it. Now that you're done with 1A, have they been contacted to get their vaccinations?
Yes. Yep. So we're holding our clinic on Thursday.
Okay.
And they were invited to that clinic.
All right, okay, thank you.
Anyone else?
That was going to be my question too.
Okay.
Mine too.
So,
I figured that. Yeah.
I just have a couple of comments. I was on the Kennewick County Renville Public Health Advisory meeting last night, and so I heard a lot of this last night, but I just want to say that in response, Commissioner Berg, to what we can do, I think the biggest thing we can do is support our staff, because they're facing a lot of criticism that is not justly, should not be justly directed at them, because they're not making the rules. They're only carrying it out. They work their butt off to get ready for a vaccination supply that did not materialize from the federal government, even though that was the reason they worked so hard to be ready. And now everybody's ready, and they're not called into action because there's no damn vaccine out there, at least not at the speed. However, I will also say that Commissioner Slavic the other day from Dakota County pointed out that if we look back 1 year, and they talked about when this vaccine would be ready. It wouldn't be ready now, according to their predictions of last year, which was very optimistic at the time. So we're about a month ahead. I think, if I recall what he pointed out the other day, we're about a month ahead, and it'll probably start moving a lot faster very soon now as another one gets. I think it's in about 10 days. Another one is.
Yeah, Johnson & Johnson is very close to being
Yep.
done with their trials.
So thank you guys for all. It really has helped me to really understand better the role of public health, and this is a perfect example of public health really dealing with these pandemics. I know it's put a lot of stress on you guys, and I appreciate your patience. I think you're putting a lot of hours in, and so sooner or later we will get to the point where we can feel comfortable and move through, and hopefully those that are reticent to take the vaccine will. It's a little frustrating actually to me that those in 1A turned it down in the beginning, and now they want to be and step in line in front of 1Bs, but it is what it is, I guess. And so be patient. It's getting there. And thank you for your work.
Yes, thank you. And Mr. Chair, if we do have just a couple minutes,
Sure.
I think Director Lieberg wanted to just give a quick update from her area.
Please. Welcome, Tammy Jo.
Good morning. Tammy Jo Lieberg, I'm the Director of Community Corrections here in Candy, Ojai County. I asked for just a few minutes just because in the last couple days, or actually in the last week, things amped up a little bit with the proposed budget going forward, and wanted to just give you a real quick update where we're sitting, because it could have profound impacts on Candy, Ojai County. Since I started, I've been working to try and find us equitable funding across statewide for community corrections. Every time we feel like we make 3 steps forward, we take 4 steps back, it feels like. And right now, that's kind of where we're at. And just for a quick for the new commissioners, just kind of go through it real fast. Minnesota has 3 probation delivery systems in the state. 90, and just kind of understanding 5% of all offenders will be released back into the community. So we have to project and see how we're going to supervise and hold people accountable, but also provide public safety through rehabilitative means. And so as part of that, Candy, Ojai has chosen to be CCA, which is Community Corrections. Our Community Corrections Department supervises everything from pretrial to juveniles to misdemeanors to felonies to supervised release. So in essence, we supervise juveniles that run away all the way to murderers coming out of prison. Okay, so it's a wide range. But across the state, there's 2 other delivery systems, Department of Corrections and CPO. CCA, Community Corrections Agencies, comprise 35 counties as of July 1st of this year. It's 34 right now, but 1 more county is going over. It's supervising all of these things. That's 72% of the offenders in the state of Minnesota are supervised by CCA counties. CPO, which is county probation officers that only supervise the juveniles and misdemeanor cases, they supervise 11% of the offenders in the state. And the Department of Corrections actually only supervises 17% of the offenders in the state. So this bears very significantly on the proposed budget right now, because even the legislative actions and some of the articles that came out in the papers yesterday said that the Department of Corrections budget was a wash. Well, the reason the Department of Corrections budget is a wash right now is because they're going to take it out of the county budgets. We are looking at a significant cut of $8.2 million in 2021, or 8.2 million in 2021, and an even greater 6.6% cut in 2022. And then again, there's indications in the budget of 2023. This would have a significant impact on community corrections and the safeties of our communities. So I wanted to make sure that we bring this forward, get people aware that this is happening, because it seems to be buried underneath all of the other rhetoric that's going on, and make sure that we kind of go through this. There's 104,000 individuals under community service, under supervision in the state of Minnesota. And so they can have a significant impact on our safety in our communities. And long-term safety includes doing evidence-based practices, making sure that we provide rehabilitation rehabilitative services and help people change their lives going forward. So I have a presentation in March, but I wanted to kind of make sure that we were on task on this as this is all kind of coming forward and that you were aware at the AMC level that this is going to be pretty significant for counties.
Thank you, Tammy Jo, and I think it would be, maybe that's what you're planning in March, but Mel Oden's over in Public Works Department. We joke with him about his whiteboard and his drawing pictures, and I really think that the 3 different delivery systems and all of that would really be beneficial to have a class 101 on how that all works. And the irony of this is, fellow commissioners, is that as the state is taking people out of prison, partly due to COVID, partly due to incarcerations that, were fairly low-level offenders, they fall on us to take care of them. So they're saving money, they're cutting budgets to take people out of incarceration, but they're not providing the funding for us to manage them when they get out of incarceration. And
So Minnesota historically has had the lowest incarceration rate within the top lowest of the 5 across the nation, right? And the highest supervision rate in terms of community supervision. We know we have better outcomes with community supervision, but in the last 3 years, to your point, Mr. Chair, is the idea that they had 11,000 individuals in our prison system 3 years ago. With utilizing policy changes and the combination of releases, which we are supervising, they've reduced that prison population to under 8,000 in the last couple of years.
AMC is, at least the Public Safety Committee has asked for more funding, not less. So
Correct.
apparently they're not hearing us.
we've been down to the excuse me, Tammy, we've been down, I think, were you with us at that? We testified, or I didn't personally testify, but I attended the hearings where there was testifying about the very high needs for this. So whatever we can do, please let us know and we'll continue.
Yeah. Any information I can provide or whatever we need, please let me know.
To give us our time for our break, we are going to adjourn the meeting right now.
Thank you.